In eye care, I make a lot of money and pay really good, pay my people and pay to see you and pay for equipment to take care of you by selling you what I prescribe. When you come to see me, if you don't order your contacts from me, you actually hurt yourself. We're actually cheaper when you factor everything in. But I confused you and I didn't make it convenient. So a lot of patients leave. 40% of our patients come in, say, Dr. Rhue, this is the best eye exam I've ever had. I'm going to one of these retailers. You
Yeah.
put me in a real weird position. I don't actually want to see you anymore as a patient because you don't
Yeah.
value me. You took up a slot for a patient that would have valued me.
Right.
So it puts us all in this really weird predicament, but we turned that on its head and we said, where is this going?
All right. Welcome back to the podcast. Thank you for joining again. I'm your host, Ben Imes. Really excited to have a great conversation today. Got an awesome guest. Why don't you introduce yourself, Miss Guest?
Miss Cass. Hi everyone. Excited to be here with Ben. Just found out we're both living or, have some roots to Colorado. And I started off as a furniture builder's daughter. So selling furniture as a 3-year-old, 4-year-old.
Nice.
Then my dad taught me really early on that you don't want to use your body to do your job. You should use your mind. And so I always knew I was on this venture to healthcare. Actually found my profession was I was in second grade and became an eye doctor in second grade when I got my first pair of glasses. And, I was like Aladdin looking through a whole new world. So a lot of jingles in my head.
You can sing it
And
if you want to.
then a whole new world. And then went to optometry school, became a doctor, and then launched a tech company along the way. Had 2 kids. I have a 9 and a 5-year-old, 4-year-old. I think I still have a husband. Hi, Josh. Love you. And now I love marrying like business, healthcare, tech, patients, meeting everybody where they need to be met because we're
Yeah.
all a cog in the wheel.
Yeah, absolutely. That's such a cool story and kind of cool motivation that you have already from just trying to marry all those things is so
Yeah.
much easier said in 5 seconds than done over a course of a career. What's been your main kind of like, let's break those down is what I'm kind of getting at. You started your own clinic or was that the first step? What was the first step?
So, first step when you become an eye doctor, so you go to 4 years of undergraduate school, or you go to 4 years of college, then you go to four
Right.
years of graduate school, and then you do a year of residency. So, you're already 9 years into becoming a doctor, an eye doctor. So, there's 3 different fields. You have ophthalmologists, optometrists, opticians. Ophthalmologists are doing very specialties, certain parts of your eye, cutting you, doing things like that. You go to med school. I didn't want to do that. I wanted to optician. Optometry marries kind of fashion with glasses and contacts and being that primary eye care doctor. And then opticians are the ones helping us fit your glasses and making sure that this invisible piece of plastic does what it's supposed to do. And we promise you the world. So it's
Of
cool
course.
where fashion meets medical, fashion meets business, doctoring meets business. And so we're living a very different world where you come and see me and I get to sell you what I prescribe. So
Yeah.
that's, hence fast forward. I joined a private practice, always knew I wanted to be a business owner because that's where I was born. My parents
Yeah.
owned a business. And it's fun seeing like my 9-year-old start to get some of this too. I'm like, oh God, I'm so
Boy.
sorry. And he's already talking about like compound interest at this point. I'm like, Jesus.
At 9?
Yeah. Funny side note, he goes to my 4-year-old, he goes, I will give you this dollar to buy this Hot Wheel, or in 10 years, I will give you $10 because that's what we call compound interest. And I was like, anyways,
What have you done?
so I bought into a clinic in 2015. I bought out my partner, and now we have a massive clinic where we specialize in seeing kids from, 6 months old up to my oldest patient is 108. So it
Wow.
really goes across the gamut. And
Yeah.
then launched the tech company in there as well.
Yeah. I mean, that's so cool. Just even being able to kind of serve that many people, right? And 108. Wow.
Yeah,
They're
she's
still moving.
feisty. She's feisty.
They
She's
usually
still
are.
wearing contacts, but
No way. Wow. I
I see her
actually
every 3 months.
what's the new is there new tech coming out kind of in your field that you're seeing with like treating patients or is it I mean are the contact lenses changing or is there diagnostics that are changing? What have you seen kind of morphing and innovating so far?
Yeah, so where the innovation is coming in, specifically the eye care space is, as you know this, Ben, there's not enough of us. There's not enough doctors, and we have really become the primary care doctor. So if
Yep.
I look pre-COVID, what conversations I was having, post-COVID, what conversations I'm having now, like I've become your diabetic doctor, I've become your hypertension doctor, I've become your psychologist, I've become your eye doctor because your eyes really are your brain. We talk about dementia. I talk about hearing. I'm like, all of these things now morphed into what is vision, because really vision is your brain, right?
Yeah.
Our eyes are our brain. You
Their
just are
extensions.
seeing your
Yeah.
brain. Like, and because you can diagnose so much through there, we can diagnose over 300 different conditions through your eyes. It's not just a prescription. And that's where this industry goes really wrong, is because that's where we're seeing this. Like get your eye exam online. Then it's not just like one or two. That's not what we do. That's the top of the funnel. That's for me to get you in. So I can measure all your cranial nerves
Yeah.
by doing an eye exam, right?
Right.
So you have 12 of them. We measure most of them in an eye exam, and I'm looking really at all of them. And now it marries all of that.
Yeah.
So
Wow.
that's what's really special about eye care. And that's where I'm seeing now you can diagnose, because it's where you can see nerve endings, it's where you can see your blood vessels without cutting you open. We're diagnosing so many different things earlier on than ever before. So there's
Okay.
this whole oculomics, is what it's called, because we can measure blood volume. We can,
Yeah.
that's where AI is getting really good, is on imagery.
Yeah.
So
Yeah.
overlapping images in that
It's
time
learning
sense.
from the models.
Yeah.
Yeah.
So yeah, that's
Okay.
like the Aura Ring wearable devices is getting really cool. The Meta glasses, like Meta just made a crazy investment in EssilorLuxottica, which owns our whole industry. It's very vertically integrated.
Uh-huh.
And
What's that going to change?
wearables. I don't know yet. It's still early. Like there's hearing aids are like becoming on your glasses. So like this is a
Yeah.
big thing because hearing's really a leading cause of dementia. So
Yeah.
as our parents, right? People in their 60s and 70s and 80s, hearing's a really big thing. And they
Yeah.
all don't want to go because there's a connotation that you're old. But there's really cool things coming that way. The Obviously, if you haven't seen the Meta glasses, I read an article like 40% of people in the next 24 months are going to be wanting a wearable device. I don't know what we're doing with all this. I really don't. Like, I don't need my whole life recorded. I really like,
No, please don't. Yeah.
yeah.
No, I have a buddy who so I he's LA, and but he I saw him back in the fall or earlier this fall, and he was wearing his Meta glasses, and he's like, check out the film that I got from this concert or from the show that I went to, and he's like showing me on his phone the recording that his glasses took of what he was looking at, and I'm like, okay, yep, you were there. He's like, you know, great. I don't know what we're learning from this. Like my phone can do the same thing if I wanted to.
But what it may be is like being more present.
Sure.
So, like, as you have a baby, right? So, one of them is one of my friends, she had twins and she's just crazy. And so she works for EssilorLuxottica and has the Meta frame. So she was wearing her glasses because she likes to take pictures of them, but
That's,
obviously not be fumbling with her phone. So like I see certain use cases, and she did. She caught her daughter's first steps by
yeah.
wearing her glasses.
And didn't have to
Maybe
run
it does
away to get her
allow us
phone.
to be more present.
Maybe. Yeah.
But then so my guilty pleasure, I still read Reader's Digest.
No.
I saw, do you
Did
know
you just
the
age
second?
yourself in front of us?
My kids are like, we're on our fifth generation of reading RD here. We probably still are the only family that gets it. So
I didn't
there's
know
this
it still
quote.
was circulating.
I have there's 5 subscriptions left. So there's so funny. They have a cartoon part, and it says like the person is entering into heaven, and it says, please go through all of and put all of your digital photos into inboxes, or like I need you to organize all your digital photos before you're
Yeah.
allowed into heaven.
Boy. Yeah,
So it's
good
like,
luck.
what are we doing with all this content?
It's true. Where does it go? All I'm doing is I'm doing this thing, and this is I was advised when your kid is born, make his Gmail account right away, upload all his pictures, sending him little emails of, hey, this day you did this day you did that. You put it in his cloud under his name. So it's out of your stuff. It's just all in him. So he has access to it and you have access to it. That's all that I'm doing. I don't know if there's other things, other ways to kind of store all this
Yeah.
content.
And then Gmail is going to become like the AOL.com. And like, look what my parents did.
Yep. It's going to come the Reader's Digest.
No, it all has its cycle.
Yeah. What
There you go.
Curious about, like, so let's shift a little bit. How did you think of starting Dr. Contact Lens, and maybe explain to the public, to my listeners, what that is?
Well, Ben, when you come to see your eye doctor or
Yes.
any physician that really wants to take good care of you, there's a part of medicine where, yes, the doctor makes money off of the plan that they have agreed to take. In eye care, I make a lot of money and pay really good, pay my people and pay to see you and pay for equipment to take care of you by selling you what I prescribe.
I see.
So entities like these online retailers, when you come to see me, if you don't order your contacts from me, you actually hurt yourself. When you look at it, we're actually cheaper when you factor everything in. But I confused you and I didn't make it convenient. So a lot of patients leave. 40% of our patients come in, say, Dr. Rhue, this is the best eye exam I've ever had. I'm going to one of these retailers. Well, that sucks. You
Yeah.
put me in a real weird position. I don't actually want to see you anymore as a patient because you don't
Yeah.
value me.
Yeah.
And you took up a slot for a patient that would have valued me.
Right. Right.
So it puts us all in this really weird predicament. But we turned that on its head and we said, where is this going? Amazon was just getting, going here in 2015, 2016. Apps were just kind of coming on our phones if we rewind what was going on. So
Sure.
we said, hey, let's build an app where our patients can order from us day or night.
Yeah.
This should be easy.
Yeah.
Every entrepreneur
Easy
is famous
button.
last.
Yeah. Every entrepreneur that has ever started anything.
Oh my God. Yeah. Now we had to sell to doctors who are not business people, most of them, to
That's very pleasant.
understand, yeah, where they're wrote a book on it, like
There you go.
get better guys. And then really just we flipped it. So instead of, printing the prescription for you, Ben, I can send you a text. And the text you can actually see that we are less expensive and you end up ordering from your doctor. Now your eye health is protected, your doctor is protected, and everybody wins.
Yeah. To
So
me, it
that's
makes just so much more sense about streamlining. I mean,
it
everyone loves
needed
that
to
word.
be. It needed
Yeah.
to be. It was crazy. Like my staff was spending 8 minutes to order a box. It's 28 steps for them to do it. It's 14 steps on yours. I'm asking you to drive back to my office at 4:58 to pick up your contacts.
Yeah.
So we
There's
just
got
saw
to be an
that
easier.
picture. We saw that wave, and how hard could it be?
So, are you selling? This is an app, correct?
So it's a software. So it's not. It
Okay.
actually didn't turn into an app. So then we realized that people only used apps that they used often. So like your Starbucks app or Amazon app where you do it. Contact lens ordering wasn't really the way. And so we pivoted and we do it through a text. And so it's just reminding you to order and you log in through the text message. It's HIPAA compliant. It's all the things that you need a medical record to be. And that's how we've grown. So we did
And
pivot really early.
that's good. And so then is it based off of your recommendations as the physician that
So it's
you're able
whatever
to?
I prescribe. So but
Good. So
when
it
you
just
come
shows
to
up.
me, yeah.
Right. That's
So
so
you
cool.
have full access to your prescription. I think that's what's really cool. As patients, you realize that you need to have the power to. This, at the
Yeah.
end of the day, is your healthcare. It's your record. I'm just holding it. I actually don't own that record. You do.
Yeah. Yeah.
So it's really frustrating if you want to go doctor to doctor and you call me. I would obviously give you your record because go. I want you to, if you need a
Right.
second opinion, go.
By
Right.
all
If you
means.
don't like me, I'm not for everybody. Go. And so that's where a lot of doctors get really hurt. It's like, why are you leaving? It's not up to you.
Right.
So
Yeah.
we need it to be more efficient and more record transferring. That's where EHRs were supposed to be really good, where they completely failed.
We could head down that rabbit hole if we wanted to, but that's just been the most frustrating thing is that they don't talk to one another very well at all. I say very
At
well. That's a
all.
very nice way of saying it.
Yeah. And they easily could, right? And so I think as more people are getting, especially our generation, we want to know what's going on. We do
Yeah.
care about longevity. We don't want to live those last 2 decades of our life like that.
Right. Right. I mean, to give perspective, even just about that, like, so last night I was on shift and patient came from Moab and sepsis of unknown or maybe abdominal origin. I'm using paper records. I'm having to filter through this transfer packet of 60 pages of paper, trying to find the details, trying to find the CT scan results when my thinking is, guys, this should just be an easy click a button and I get to see what the images look like. I get to see all the details of her previous visits to every physician she's ever seen. It should be that way. But
I think that's where you're seeing things like this. This is becoming our health record really fast.
yeah,
That's where this is all headed. So I think these EMRs have had their heyday,
yeah,
and it's even like companies like mine begging to get access to this so I can stay in business. And they're like, nope, we're good. All right, well, now I just became a hacker. So you don't
right.
tell this one no.
Yeah. Try to tell me no, I'll find a way around.
Try to underestimate me. This shall be fun. Good luck landing.
Exactly. So, talking about how you've kind of like grown this business while also running a clinic,
Yeah.
are you selling this as a software to other physicians and other clinics and kind of just white glove kind of delivery?
Yeah. Yeah.
Okay.
So
What's
I mean,
been
we've just done it one clinic at a time.
okay.
Where I see this really shift with physicians, and you'll appreciate this, right? When you go to medical school, optometry school, dentist school, whatever it may be, you're going to that school to learn that field. We get no business degrees because
What?
looking at a P&L is not on our boards. So why am I going to learn it? I don't learn leadership. I don't learn those things. And so I come out in this positional leadership position, but I've never done any leadership things to get there. Right. And
It's
that's where I
assumed.
learned really, yeah, really early on the value of the people around you. Right. I got into med school. I could have gone to med school. I didn't want to. You easily could have too. You went down the PA route. Doesn't
Yeah.
mean there's like, I don't know what they get injected with, but my husband was injected with it too because he's an MD. And it's like this.
It's
And
a
I know you
Kool-Aid.
have to have that complex. It
Yeah.
is a Kool-Aid.
Yeah.
Really good tasting. So the positional leadership that you have versus the transformational leadership that you need
Right.
to understand the business workings. I hate that doctors have become the pawn in the system.
Right. Right.
I hate it.
They're
And
the
if you
middlemen.
learn just a little bit about this on the value of overcoding, undercoding, overtesting, undertesting, these inner relationships that we all have to have,
Yeah.
this could be so magnificent.
Yeah. Could be. Talk more about that. I mean, even just you mentioned the people around you, and that's very important. You said
Yeah, so in
that the
growing
most
the clinic, I realized, you're the business owner. You're the
right,
smaller that you are, the more hats you have to wear,
right.
right? I'm
You're the
wearing
bookkeeper.
payroll. I'm wearing fire extinguishers, now expired. I'm tech.
Yep.
The EHR is broken. This chair needs to be reordered. The carpet's torn. It's like, and I have to see 25 patients that day in a good mood.
Yeah.
Yes, please let me make your dreams come true. And
And
some,
only one of those actually brings home the bills to pay for everything else,
yes, yes, yeah,
by the way.
that one, yeah, seeing patients, weird. as a
Yeah,
doctor. Huh. Imagine that. And so I learned really early on that I had to get those hats off my place and off my head, and that people are very capable around you. It's a trust factor, it's a feedback loop that you have. And that allows me to do this better, and that allows them to be better. And then everybody rises. So it's an empowerment thing where we all play our part. And when you try to step on toes and don't let that happen, you are going to
yeah,
burn out.
yeah. It's true. I mean, if you try and wear every hat without delegating all these things, I feel like that's like a recipe for disaster. And honestly, like people are very, like you said, people are very capable. Even today, I think there's just so many things that you could even probably, I know you're wearing 5 hats still, if not more. But
No, I
no,
got fired a long time ago from both my businesses.
founder. That's
But
why
I
you
get
say
to do
founder.
stuff like this.
Yeah, yeah. You can actually see your children during the week and teach them what Reader's Digest is.
Exactly.
The what I love here's what I love though. I think, and you can speak more about this, is the fact that, like you said, emphasizing this, you come out of any specialty and it's assumed that you are a leader. Honestly, and you see this a lot in the healthcare culture right now. Nurses become nurses, work for a few years, and then all of a sudden they're in nursing leadership over physicians and stuff. And it's like, what what did you guys do? Did you guys do something different? It's like, no, it's just assumed. You know how to lead, you know how to govern. And it's the same thing with, our field. We're specialists and it's assumed that we know how to lead people, but it's a learned thing. It's a learned thing. And I think what you're speaking to and what I've kind of seen is you got to surround yourself with the good people, like the people that amplify your talents, but also help support where your weaknesses are, right? Because if you're
Well,
if you're
to
not able to,
amplify that, then what happens, and I think if you look to the leaders that are strong, it's the ones where we did odd jobs growing up.
what
But
was yours?
in that, mine was like a guy I sold furniture since I was 3. And then I worked in a 5-star hotel at the Broadmoor. That was a cool job. And, server based stuff, just getting through school. But the piece to that is I never understood what a CEO was, what a CFO was an ops person was, what strategy was, what like I didn't understand any of that because I never worked for any of that. I did small mom and pop jobs, right? So now you go into this big setting and you don't understand that hierarchy. You don't
Right,
understand where you fit into all of that because it's all just one big puzzle, but none of it talks.
right.
So then you become that positional leader without doing the work to get there because you just graduated there. So you're fitting into that bucket. And that's, I think, where you said it earlier is the only job in there that makes me money is seeing patients.
Yeah, yeah, that's
So,
true.
but you still have to have your pulse on everything else because of that. Are you billing correctly? Do you have enough tech support to make it so you can just do what you do?
Right,
Do you need a scribe where you can see 20 more patients where it felt like you saw 20? Not just to see more patients, to see more patients. See more patients effectively
yeah,
for them.
yep,
So that's where I've understood if you want to make $1 million, right? You take $1 million and you divide that by 2,000 hours. And that is, wait, do that. It's $500 an hour. So is every hour that you are working, are you producing $500?
right,
If I'm answering emails and trying to record this podcast, no,
right,
Lane. And that's where you understand if I'm doing a $20 an hour task, but I should be doing a $500 an hour task, I just cost my company $480. So
yep.
that's the book that's changed my life. And I'm talking this way is because I read a lot, 10 pages a day.
What are some of the books that have kind of like helped you learn these tasks or learn the
My
emphasis?
biggest life changing read is Buy Back Your Time by Dan
Yep,
Martell.
yep. I know that one.
Entrepreneurship Beyond Entrepreneurship 2.0, so anything by Jim Collins.
Okay.
Just read The Stress Paradox. It's a little sciencey. Really, it's just like longevity and that stress is actually good in your life. We're taught that it's bad. So there's a whole different science here that actually stress is very good. If you look at
Yeah.
entrepreneurs, we all have a chip on our shoulder that we're trying to prove from somebody that beat us up in, well, my girl was, fourth grade. Then you have, right? So you kind
That's
of
true.
see these patterns
Yeah.
in all of the books.
Right.
So it's really mindset. Big thing of this is mindset and just having freaking fun, man. Like, I'm not telling you every day is like rainbows and butterflies. Like, yesterday was
No.
not one of those.
Right. I mean, but here's the thing. Like, I want my listeners to hear this, that what you're saying is so true and so valid. I mean, bringing it up to, yes, the journey it's up and down, all right? It's up and down, it's up and down. But can you be grateful and kind of enjoy the ride? Yes, you can.
Have to.
Because if you're not, then you should just stop doing it that way, because there's even if you make it at that, let's say you make it at that point. I actually was talking with somebody about this yesterday. Let's say, okay, you want to make $1 million and you've made it. You came from scraps and you made $1 million, right? Okay, so now what? I mean, you were unhappy the whole time. You were ungrateful when you had nothing. Now you've made $1 million and you're still similarly
It's
unhappy.
only going to amplify that.
Yeah. You beat me to it. You stole my punchline.
No, well, and that's where you hear this too, is the mindset shift that's happening. But you also, I don't think people tell you this little nugget too. Your 20s, right? Those are like your planting seed years. Plant as many seeds as you freaking can, man, because you don't
Do
know
everything.
where you're going to go. Open as many doors as
Yep.
freaking possible. And those are your listening years. No
Mhm.
one's going to hear you.
Yep.
Freaking 20. I'm sorry. They're not. Okay? Can we
Yep.
cuss on here? Or
That's okay.
beep that? Sorry, a little positive. Then your 30s, you start to reap some of those, right?
Yep.
And you start getting a better voice.
Yep.
And then your 40s is when people start paying attention to you. Your 50s, you jump to a different curve. Where now those are like your give back years.
Right.
Then your 60s are your legacy years, because now you have all this knowledge and you want to give it, but you have to even become a better listener because they need to solve their own problems. And then your 70s, 80s, and 90s, you want those decades to be really fruitful.
Totally.
So
it's a great
were you
point.
working out? Were you drinking Dunkin' Donuts when you were 43?
Answer is always yes.
So
Better
I
than,
think it's like
we'll say better than
looking
Dutch
at the
Bros.
decades. I don't eat those. I don't think we have those down here yet. So I think that's like the joke. Like my hubby just turned. I won't throw him out there, but I'm like, Josh, this doesn't get easier, man. Like, you're gonna get more creaky. You're gonna have to work harder than ever. You have to laugh. Like, I will never need reading glasses then. Ever. I'm just stuck at 38. I'm not doing it. I'm actually 425. You just don't know it.
Exactly. You've descaled. Your longevity medicine has been, you biohacked it.
I did. I think it's just laughter and all of it is just.
Oh, 100%. Yeah, that's what keeps you going.
You see the patients and you can see it.
Yeah.
You see the patients in their like 70s, 80s, and 90s that have had a good freaking time. And you see the patients that are miserable. And I can tell you the ones when I see them in 30s and as they go on, that sucks. That really sucks. You're looking through a really blurry lens.
Yep. I mean, we talk about that's a good analogy. I like that. You've used that too many times, I'm sure.
No, I've never.
No, what? I feel like that's an optometrist, like.
Well, it's a mindset thing,
Totally.
right? Like, I can see it in your face. Like, you have your smile lines up, which means you're full of joy and happiness and laughter. And then you see people where their smile lines are down and they're like that grimace face. Like, when our parents were like, your face is going to get stuck like that.
They're not quite wrong.
Does.
Yeah, they're not very wrong.
They're not wrong because I can tell your face got stuck like that.
Yep. I mean, what I like to see, I mean, it's a kind of a point that you've proven already, but like when a patient comes in and I'll tell one of the supervising physicians that I'm working with, I'm like, yeah, so this patient's like 48, looks like 78. And they're like, huh? And I'm like, trust me, walk in the room, go look. And it's it's mentality, but it's also, I think that mentality affects your disease processes, right? And it ultimately, last thing, it just affects your outlook on life and how your life kind of progresses. But then you've got the 90-year-olds like you're talking about with your 108-year-old patient. I mean, they can still crack jokes in their 90s, still walking. You can tell that they've lived a good life. You can tell that they've kept that mentality throughout their life, like staying very positive, whatever it may be. I mean, it may be, for some people it may be faith, for some people it may be like their entrepreneurship or their business. Some people may be their family, whatever carries them through, but you know, it's finding that thing, latching onto it as hard as you can, and not letting go for the entirety of your life, because you know that that's what's giving you the fuel to continue.
Reader's Digest.
We've got to throw that in there. P.S. That was good. That was good.
It is a
I'm gonna
very
go.
positive magazine.
You
Not
know,
gonna
I'm gonna
die.
go
I'm not
like
gonna lie.
look it up. I'm gonna go look up a subscription now after we finish recording.
You have to. And honestly, it's like it's such a cool magazine because it's like a positive magazine. It's very it's like the stories like make you cry and you're like, "Oh my God." Like
Yeah,
that's really cool. And it's like gruesome stuff sometimes, but they always have like a positive spin on it. I was like, there it is.
it's like, is this gonna turn at any time?
Then it does. They always do.
It always brings it back. I love that. Maybe I'll go check it out.
Mm,
But the
you sure?
okay, so I'm gonna get more specifics. We've jumped around a lot, but I'm gonna shift it again because I love shifting. Now, how have you seen this? What's been the most difficult thing about trying to sell this while seeing patients? I mean, because you obviously have to market it somehow. I mean, did you do it all yourself for 8 years and then figure out, wait a second, I can't do this. I have to hire the person to do this, or find the systems that work, implement those. I mean, I'm
Yeah.
or still
Look,
figuring it out.
I still have a concussion from like learning this, like beating my head against the wall trying to sell to doctors. I mean, we really have just done it one clinic at a time, being on the floor. So now I've become a vendor, right? So it's fun because I sit both as like a speaker. So I love to educate, I love to entertain. So I've gotten myself on a lot of stages because I have a clinic. I see patients every day. And so I found something that lit me up in clinic, which is myopia management. So if you're listening to this and you have kiddos, please get your kids' eyes checked. There's things that we can do to help so they don't become as nearsighted and have problems. So there's my little plug for the kids. Really cool stuff we can do. Get them off devices. Please get outside. Like, be a parent. Like, they're entertained by a pen and a rock. Like, for
And a
real.
box.
Okay,
Don't
we can
forget the
do better.
cardboard box.
Seriously, like, just be a kid. They
Yep.
don't need it. They don't need it. So please stop. And then I we had to build a whole marketing plan. I didn't understand what a CRM was, like this whole tool, like
Yeah.
that. You should see our CRM. It's an absolute mess because I had no idea what we were doing.
God.
Now it's all cleaned up, but
Oh, okay. I was gonna
we
say,
had to be
wait, is this still an
marketers.
issue?
We had to be marketers. You know, we had to build a booth and sell it. And that's how we met, was on LinkedIn, and like
Yeah.
being now became the face of a brand. So now what's interesting is the have to stay sharp in clinic because that's my joy, part of it. But also the jealousy factor here where they're like, you got out, like you still see patients, right? Like they want to make sure I still see patients. I'm like,
Yeah.
yeah, I do. I still have a clinic. I still run it every day like you do. But I connected it back to why we all keep this industry going is because of patients.
Right.
Make this easy, make it convenient. We've been knocked off now multiple times by other companies. We've had cartoon characters made out of us in the industry because when you have a good idea, it's not when you get knocked off, it's when you get knocked off. So we've been knocked off now multiple times. And my friends will call me like, did you see this one? I'm going to go with this one. And I'm like, okay, like
Okay.
same color, same design, everything. Like,
Gosh. It means you're doing something right.
Good. That's good. Yeah. So it's been because they're my colleagues first, and then they
Yeah.
become my customers, and it's a really hard place to sit.
Yeah.
But because we did such a good job, we made it look really easy.
Yeah.
This is not easy. I mean,
Well, also
having
you could
customer success and all that comes with it.
even just selling to physicians is the hardest thing. You could have like just planted your flag there and said this is the hardest because
It
every
is because
there's
there's my book, the iPitch book
yep.
on clinical and business mind. So clinic, if you're selling to physicians and clinic, right, they're taught to be clear, confident, and concise and first do no harm with patients so they don't get sued. Can't take risk with a patient. On the business side, your business brain, so if there's any reps listening to this, you got to get me into business mindset. If you walk in and I'm running behind with 5 patients, how can I make a business decision in clinical mindset? I can't because in business, I have to take risk, right?
That's what
But
it's
it's
built
just a
on.
series of questions. You got to ask me questions
Yeah.
because my first thing is I'm going to ask you, what does it cost?
Yep.
And there's no where that conversation can go if that's my first question.
They're like, well, we have to understand everything before we get to that.
That's all I was taught to ask.
Yeah. Yeah. And probably every other physician that you're selling to.
Yeah.
Yeah.
So that's also what I teach them is I want the doctors, if you're a physician, PA, dentist, whatever you're listening to here, realize where you sit. You're the shark in Shark Tank. Everybody wants what you have.
Yeah, it's true.
So you are what makes the business go around because you're the one that says yes, you're the one with the checkbook.
Right.
Guess what? Your checkbook gets bigger because you're making everybody else's bigger. So if you want to be a millionaire, you got to help a million people. That includes your reps. That includes your patients. That includes being in these conversations with how you want tech to work.
Yeah. Yeah, it's true. How
But you
have you
also have to see
seen
patients.
yeah, yeah, you also have to see patients. Don't forget that part. What I mean, have you seen like the tech revolution and the AI stuff kind of change a lot of things when it comes to that business or not as much?
It's still very slow, like mindfully slow, painfully slow, because the EMR systems are really shaky. Like they're ground level. I love how we're like getting into AI. Guys, like we're 7, 8, 10 years away from this. We don't have infrastructure, we don't have supercomputers, we don't have the engineers we need, and we don't have the power. And what are we going to do with all that data anyways? Just because I can diagnose you with something 10, 15 years earlier, can I do anything about it? Sometimes ignorance is bliss a little bit.
Unique point of view.
So yes, you want to know those things if you can do something about it. But if you can't, I don't know. You're just
Yeah.
going to sit there and worry now that that's your fate. That's not a fun place to live either.
No, I don't. Yeah, I agree with that.
So I'm seeing like diagnostics get better. Diagnostic, like that's for like breast cancer with AI screening. Very cool,
Yeah.
right?
Yep.
But some of the other things I don't really know. Just because you have the data, what does it mean?
It's how can we interpret this? Like, is there a way to use this? I think there's very much. I love that we're attempting to grow in this way, but I know that the medical field is so slow to adopt the advances that come in tech. Right? We're the slowest, I think, of anybody of any industry because all of us are skeptical, and it shows in our EMRs, EHRs, right? I mean, they're like, I need this. Every physician needs something different in their EHR or EMR, something that, well, I don't like this, this little specific part where I put my physical exam. I don't like the click boxes here. Change that. And so they have to re engineer the whole thing.
And then
Then
we
you come,
break 9 other things behind.
exactly. That's what I was getting to. and and you're like, okay, wait, we can't fit everybody, but there has to be a better way to do this. And look, now we've circled back to the EHRs and not being what we want them to be. But I mean, even just looking at like, even just other industries are so advanced
Well,
already.
once you get locked into a model, so we were just at the Inc. 5000. So our company made the Inc. 5000 for 3 years in a row, which is so cool. And so you're in this room with all these founders and, like the Carvana people were there and Poppy
Wow.
was there and these big brands, Dame and John, like just in like having conversations with these people.
Right.
And the Carvana guys, they said once the industry gets locked in and the model's not all the way broken and people get really fat and happy, literally now we have a pill to undo all that. So dumb, like a shot. Jesus, let's make everybody fat and then
We
sell
don't
you
have to
drugs
go.
to
We
like
don't have
undo
to
it.
go down that route. I have so.
What movie are we living in right now? I think it's like iRobot meets Wall-E meets Idiocracy.
Uh,
Meets
we could
anyway,
just camp in idiocracy.
right there.
I got my medical degree from Costco. Did you get yours there?
$4. Actually, my school almost got bought by like this was in 2015. Like Art Nova has all these undergraduate programs
Yeah,
and
I've seen. Yeah,
their endowment was like suffering. And so they went to sell the school names to like an industry person. And I was like, oh, hell no. Like,
that's first step.
and we all got it undone, by the way. We all fought. And we're like, absolutely not.
Good. Anyways,
I don't even know where we're going with the conversation.
you were just talking about just talking to all these industry people who've popped off. You know, the poppy.
Yeah. And so part of it was like once an industry gets locked in, it's really hard to undo it.
Yeah.
And so it really does take an outsider to build a whole nother model. And number one, like if you look at the Carvana guys, they had to IPO because they couldn't raise Silicon Valley money, so they had to raise New York money, which is then you go on the stock exchange. It went up to like $340. Then it went down to $3 a share, right? And then it went back up. Now they're like trading like 375. And he's like, yeah, think about that roller coaster where
No
he's
thanks.
like, but we didn't run out. Like we didn't make it to zero. So we were still alive.
It's like I don't have any legs and I got one arm left, but I'm still alive.
He's like Wolf on Wall Street and he's like limping down.
I'm crawling forward one step at a time, or one crawling forward step at a time.
Yeah. So that's really cool to see their story where again, car industry super locked in. They knew there had to be a better way. They couldn't depend on any partners in the industry and they built
Yeah.
it and now they've changed car buying and they did it in 12 years.
I mean, they had to overcome a lot of hurdles, definitely.
The vending machine, the car vending machine was just a stupid idea that they were passing around. Like it was just somebody blurted it out at a meeting. It was like, why don't we do it at the vending machine? And they're like, that's a good idea.
Let's run with it. I've seen
That's
it.
how it was.
I know. I've seen it. It's so interesting. What do you think? I mean, so they, like, from your perspective, what's your biggest hurdles? What have you seen like over the years, right? Because obviously you had 100 hurdles in the first year, 2, 3, but what have you seen kind of continue to kind of develop as you've been along this journey?
Biggest hurdles has been the industry saying like this, we just don't need this. So getting the partnerships, getting into the EMRs, that's been obviously one hurdle that we've overcome, right?
Yeah.
The next one is understanding you run a business. As a physician, you are not a charity. You are allowed to charge.
Yeah.
And you run a business. So
Pay yourself
you're not a
first.
charity. And 95% of physicians, that's why private equity has come into all of these industries and swooped them all up. So now you're working for the man
Right.
because you didn't want to learn this little side of the business side.
Right.
And it's not that hard. So if you take away anything from this, it's just not that hard.
That's the solution. If all the
So
listeners
be the
hear that.
leader in your own clinic. If you don't like how something is run, be a squeaky wheel. So you
Yeah.
can get more effective. You can get more efficient. You're using your PAs, you're using your techs, you're using like people that are advancing, understand where they sit.
Yeah. Yeah. I mean, there's
That's
lessons
my
to be learned through all that. I mean, like those hurdles you have to learn from, right? Because those hurdles can become walls that are built if you're not learning from getting over them,
God, yeah.
right?
We've had some down. Like
Yeah.
one guy, like 2 weeks ago, was at an industry meeting, and it's funny because there's like 75 big wig industry people, and I'm one of 2 practicing optometrists. So these people are all making business decisions that are going to affect me, but I'm very underrepresented in the room because they all want to
Sure.
go around me because I'm the person they have to get through because we're so slow to change as physicians, right? They have
Right.
businesses to protect. So they're who's selling to me. And one of them, he goes, I really never thought you'd make it this far. I was like,
Cool.
thanks. And I'm like,
Yeah, is that a pat on the
I
back
know
or
that's
is
a
that a
dig. I know that's a dig, but I'm gonna take it as a compliment.
yeah. Because we're positive thinkers.
Like, Ben, can you pull that arrow out of my back? It's right.
Yeah. It's like I really thought you were gonna fail. I actually bet on you to fail.
He did. Like, he could have helped me a long time ago. And I would be 4 times bigger than what I am right now. So it's understanding, like, you do, by you not being innovative and you not saying yes quickly, right? You're hurting yourself. So I love to live in expansion, not like constriction. Just don't live there.
I
And
think
so many of us do.
what you're speaking to, and reflect on this if you can, but I think it's working out of an abundance mindset rather than a scarcity mindset, right? I mean, I think that's something that I've been learning is if you show up expecting great things to happen and not being able to, like you said, like put your own barriers up, but if you work towards there not being barriers in your business, then it's going to grow without you. I mean, all you have to do is show up, right? Keep doing the things you're doing. You just have to keep plugging in, staying consistent, being happy through the process. The lows hit, you're still happy. The highs hit, you're still same level. But if you're working from that abundance mindset, then I think there's a more positive view of this is going to be fine. Everything's going to be fine. You know?
It's not easy. It's finding your tribe. It's finding people you can laugh with, cry with. Like, again, at the Inc. 5000 in there, I think that room could instantly go to hysterically crying to hysterically laughing. It's
Yeah. Yeah.
So it's finding that where you're either part of the problem or you're part of the solution. And I think too many of us are being part of the problem versus part of the solution.
How do we
So
change
which
it?
one do you want to be? Which friend do you want to be? Which
Yeah,
colleague do you want to be? Because you
totally.
can find that tribe. Like, there's a Facebook group that deletes every single one of my posts. So I just don't post anymore. In
Huh?
our industry.
Oh, okay. Okay.
And that I kind of helped build a little bit too in the beginning. So this is weird. Uh,
Oh, awkward.
yeah. And so it's also understand, like, when you're looking for answers, you're going to see the one you want if you don't have a filter. And so it's understanding what your filter is. There's another great book called Business Outside. He's actually a guy from Boulder that wrote it. And it's a fun exercise to do. You take 50 words and the 50 become 10, 10 become 5, 5 become 3, 3 is your core values. And it's really understanding it helped my marriage. It helped my whole entire team. I understood
Wow.
them more
Wow.
on what their core values are because you can't change those. That's rooted in you,
Yeah.
but you can play to those.
Right.
And that's been a big piece to my success is understanding, like, take my marriage for instance. Like, we're in that messy middle of marriage where we have 2 busy kids, 2 busy lives. Food. It's just nuts.
Yeah.
Dinner conversations suck. We're
Yep.
both tired. Like, we need the house people, like, a live in. I'm like, can I just go find a wife or something? I don't know.
You should
To
wife.
do all this stuff. Does Rosie exist out there? So when I realized, because I do travel a lot, because I got out of the exam room and it was
Yeah.
suffocating me. Like, I was in a dark room all day, counting to the number 2. Like, I did a good job at it, but
Yep.
it's just wasn't lighting me up anymore. And so here was Dr. Contact Lens. So I do travel a lot and I love it, but it's a lot on him. And so
Yeah.
when we were having issues, I had him do the exercise, and my 3 core values are joy, like that heartfelt joy, like in the middle of your core and like embodies you. Then my other one is risk. Like, I'm a cheerleader. Throw me up as high as you can, catch me. If you drop me, we'll, hopefully we can dust it off.
Yeah.
And then my other one is personal freedom. I'm going to come and go as I want, do as I want,
Yeah. Yeah.
not be tied down to things. But then his are adventure, like let me go on this hike, but not get too close to the cliff. Happiness, but like it's a different type of happy.
It's
And his
happy and joy are a little different there.
they are. And his other one was security. So when I'm this
Ooh,
risk
security versus
taker,
risk.
I actually honor him being the secure one, because if you have two of those in a relationship, that's very dangerous.
Yes, you're right.
And that's actually where we I could see the common ground. And then now, that's what I love in him. It's what he loves in me. And that's what also makes us fight and then makes us up.
Yeah. Yeah. And you had to figure that out though, right? You had to go through that. It wasn't, yeah, it wasn't just like this is how the life plan is mapped out.
Yeah.
We'll address it when we get there, is what I always say.
Hmm.
Yeah. I mean, just like you said, so in that same vein, like what do you see kind of moving forward like over the next 5 years? What's your 5-year plan for your clinic and your 5-year plan for your business for Dr. Contact Lens, and then 5-year plan for fun things?
So 5 years, I'll be 48. So I was kind of like to do the math game. So 48, I'll have a 14-year-old, I'll have a 9-year-old. Josh will be in his 50s. The clinic is still going to be growing, seeing a ton of kids, myopia management. I'll have published a book. I'll be kind of on the big speaker circuit, and that, like, that's what really lights me up. I love the stage. I love motivating. I love things like this. We'll be traveling a lot, but again, the kids are going to still be in school.
Sure.
So we're kind of tied down there. And then Dr. Contact Lens is morphed into I don't even know what. I mean, probably with a big industry partner somewhere there and building something. Always going to be building. I'll probably retire somewhere in there and then not retire for like a week. Like everyone's like, yeah, you're going to like, I don't think I'll ever retire. I think I'm retired right now. I think I retired when I graduated optometry school, or at least when I paid off the loan.
Bless. I oh, that day probably felt like the day.
It was the day. That was the day I retired. I literally just worked.
I
I did for 7 years of my life. I was the doctor there on Saturdays for 7 years. Every Saturday. Talk about Costcoians, man. You guys are weird. Now I became one of them. Weird.
Yep. Yep. You're part of that crew now and forever.
I ate lunch for 7 years with samples. 'Cause I couldn't afford the hot dog.
You're like, this money needs to go towards my loan. The $1.25 can't pay for the hot
And it
dog.
compounded. Now it's worth 10.
It's true. It's true. You were talking about odd jobs earlier. And I didn't even, so my oddest job that I grew up doing, I actually got hired as my first job, like officially W-2 employee at Chick-fil-A. And you're like, okay, that's great. Yeah. No, I was hired specifically because I was tall enough to fit the cow costume. Yep.
So you didn't even have to say my pleasure.
I didn't. I was actually told you can't speak. We'll
No.
just have kids who are all around groin height just run at you as fast as they can.
You cannot see. That's so funny.
Yes, that's what happened. And my spotter, you always have a spotter, and my spotter did not play good defense, I'll just say. They were not good basketball players. They were not boxing out.
That is amazing, Ben.
Yeah, as a 16-year-old, you're having to like kind of like punch kids in the head a little bit as they're running at you to hug you.
Oh my God, I love that. How long did you last?
I lasted for a whole summer where it was brutal. They didn't, so this is behind the scenes. I don't know if Chick-fil-A is going to come after me now, but they have typically under those things, it's incredibly hot. It's double the heat of a sauna. I'm in the humidity of summer in North Carolina.
So it's a little
Outside.
hot.
But normally you're supposed to get these cool like vests that are full of ice packs. I was not given any of that. I would lose 5 to 7 pounds per event.
They didn't have like the lemonade like going through like your Sunjoy.
They didn't. They didn't. They didn't have any ice cream, any tea, nothing. I was just drenched. I would get out just like I'd gotten out of the pool, lasted
Oh
a
my
whole
goodness.
summer, and then I said, this is terrible. I'm not going to show back up.
Love that. But again, it's like little things like that where I think things like that is who makes you you.
Yeah. Yeah. I mean, you have to go through the school of hard knocks, right? I mean, you have to learn how to do that so that you can get to a point of knowing where you don't want to be in the future.
Well, that and then honestly, like respecting again, we were talking about that, like respecting the journey and respecting people that
Yeah.
are like where they are in that.
Yeah.
Right. Because I think everybody now comes out like, oh, I want to be right at the top. I'm gonna be this YouTuber, this whatever. Doesn't work like that, guy. We're all doing the same thing. You think Taylor Swift is still not hustling every day? Like,
That girl is getting after.
that's what she does. Like in the Inc. 5000 room, I was like, man, I could have worked harder. What are you doing, slacker? Like, I'm like looking at myself. I'm like, you're a slacker.
Well, yeah, if you comparing is the devil. But it's like, but then you think about it, I think about it like the way of it, you got to plant the seeds, right? You were talking about that earlier about the age generations and kind of your 20s walk through every door, your 30s, people are paying attention to you, but maybe you're seeing a little bit of fruit, but normally that's going to come a little bit later, right? I mean, I think in the 20s and 30s, that's like explore everything and find out what you're good at or find what makes you tick, right?
Because that's what's going to pay you in your 40s and your 50s.
Yep. Yep. And
So if
make
you
those
don't
risks.
do that
Take those
work,
risks then.
yeah, if you don't take those paths in your 20s and 30s, you're never going to find that one. Um,
Yeah. I mean, what
and
you started
I like your
Dr. Contact's lens. You started Dr. Contact Lens in your 30s. I mean, people weren't listening to you, but now they are.
and I was 9 months pregnant when we started that because
That's how it works.
why not have a baby and start a business at the same time? So it literally, Dr. Contact Lens, like literally acts like him. Like he's now becoming this like unruly 9-year-old, 10-year-old. Not like that's exactly what Dr. Contact Lens is. Like we got it to walk, we got to crawl, we got it to
Yep.
walk, we got it to run. Then
It's
it
potty
gets
trained.
lazy. And then
Mostly.
now it's like becoming this unruly monster. Really is the cycle of business. I mean, it really is. People, that's why they call business your baby.
Yep. Yep.
Really is.
Because there's a
It really
maturation
is a
process,
baby.
right?
Yeah.
Yeah.
So
Man, so Brianna, I'm gonna close this out, kind of tie this off. Where do people reach out to you? Where do people find your stuff? You've already mentioned LinkedIn and stuff, but if they're going to see their optometrist, in Boulder, Colorado, Colorado Springs, how do they find your stuff? How do they get connected with what you're doing?
yeah, so LinkedIn is really my jam. I talk every day on there. So I'm in a coaching program where you are required to post every day. And it's actually now I've been now in it for 7 months. And it's become now weird not to do it. So just engage on social media, guys. It's social media.
Yep.
Like be the social part of it. And again, Dr. Contact Lens is in a bunch of different clinics from Florida to Alaska. So you can find doctors there that are using it, that are advancing there, and just get your eyes checked by somebody good in your area. But that's where you can find me. It's really on LinkedIn and podcasts like this. So I do host another podcast. It's called Book Nerd. So you can just Google my name, Brianna Rhue. We break down a business book every month, and then we kind of reciprocate it back into eye care or into the medical space. Or like last month we read the Matheny Manifesto, which was a baseball book
Cool.
on leadership. So we just pick kind of all over the place
That's
on
fun.
life lessons. So that's where
That's
else you
super
can
fun.
find.
That's been most of our conversation today. So I think
Yeah,
I
life.
think I think that podcast will be really fun to listen to.
What's
Yeah.
your biggest takeaway from our conversation?
Whoa. I'm the interviewer. No, just kidding.
I'm flipping the script.
Yeah, I think the biggest takeaway from my conversations that I've had is that, and the common theme, I'll talk about the common theme because entrepreneur mindset, there's 100 podcasts, there's 100 lessons to be learned from kind of across the socials, we'll say at this point. But I think the biggest thing that I'm picking up and taking away is the fact that there are still people in the healthcare field, and I say still because they're trying to turn us into a business, the big corporations, but there are still physicians, RNs, healthcare CEOs in like smaller health tech businesses that actually do care for people. Like they still care about the patient. You brought that up a couple times in our interview, but I think the thing that I've seen across the board, the people that I've interviewed, they really actually still do care about their patients and they really love being patient facing. And that's still, I mean, that's their reason for the season kind of thing. Like that's the secret sauce. And good people treat people well. And when you're treating from a healthy mentality, your patients do better, right? I've seen burned out providers and I see how they treat their patients. And we've all probably seen that in our field. But across my interviews that I've seen, at least the people that I've interviewed, all these people are in a good, healthy spot from what I can tell and are actually trying to help the people that they're seeing on a daily basis, daily or weekly, whatever their rhythms are. So it fires me up because people, when I show up for a shift and I think I saw last night, I think I saw out of the 12 patients I took care of, I think 5 of them were drunk. And it's like, that's not really medically exciting. You didn't get into emergency medicine to see drunk people and watch them just kind of sober up, you know, but you build up the empathy so that you can pour it out on the people that actually need it, you know? Or come beside the homeless person who's, a little off, but you just say, "Hey, listen, I'm sorry that you're in this situation. I can fix your medical issues, but I can't fix, these other things. But I'm with you and I'm sorry that life is hard." Right? And it gives me the kind of capacity to continue to be good or try.
I love that. I love
Yeah.
that. Well, I appreciate you having me on and
Yeah. Thanks for joining. I
keep it
really
up.
appreciate your time. Really excited to see what comes in the next. We'll check in 5 years. No, we'll check in next year. And we'll see where
Yeah,
things
let's do it.
are. All right, Brianna. Thanks for your time today. Bye.